A lot of women come to the hospital complaining of irregular menstruation, otherwise known as irregular periods. In this video, talking about reproductive health for women, we'll be looking at what irregular periods mean, what are the causes of irregular periods, the symptoms of irregular periods, how can you know whether you are having an irregular period, and of course, how the diagnosis of an irregular period is made, and then the treatment of irregular periods. You are welcome once again to Health and Lifestyle with Dr. Soyemi. So what is an irregular period? An irregular period is simply menstrual cycle that is different from the typical pattern in terms of timing and in relation to the pattern of bleeding. A normal menstrual cycle has pattern in terms of the frequency, the duration, and the intensity of bleeding. Menstrual cycle pattern in terms of the frequency, the duration, and the intensity of the bleeding that occurs during the menstrual cycle. In other words, these changes in pattern or a change in pattern is related to the changes in the length of the menstrual cycle. Secondly, related to the unpredictability of the onset of the menstrual cycle. And thirdly, a variation in the volume of menstrual bleeding. So with that simple explanation, you can know as a woman whether you are having an irregular period. You can also take time to watch my videos on what a normal menstrual cycle is. Some videos on the menstrual cycle. Check through the playlist to watch those videos. So for the purpose of this discussion, we are looking at the causes of irregular periods. So what are the causes of irregular periods? They can be divided basically into two major causes. For the first, the physiological causes of irregular periods, and the other part, the pathological causes. Talking about the physiological causes of irregular periods, menarche, when a woman begins her menstrual cycle. Menarche is a common cause of irregular periods. This is the first experience that a young woman has of a menstrual cycle. The onset, the beginning of the menses for a woman, that's the beginning of the reproductive cycle in that sense. So when a woman for the first year, 1 or 2 years, a woman may have irregular periods. That is, she may not likely see a period every month from the first experience. She may have 3 to 4 times just within a year. In this situation, there will be no need to worry. But there are some other symptoms that may require that such a person presents to a doctor or is taken to be seen by a doctor. That is beyond the scope of this discussion. The second cause, physiological cause of irregular periods is menopause. That is the condition where a woman has stopped her menstrual cycle. Prior to this end of the menstrual cycle experience, a woman around the menopause, that is the perimenopausal period, is a period where a woman begins to have an irregular period. Irregular in terms of the frequency, as mentioned earlier, the onset, and even the amount of bleeding that occurs. So that may also happen within the last 2 to 3 years before a woman eventually stops having a menstrual cycle, before a woman stops menstruating. Now let's talk about the pathological causes of irregular periods. One very common cause of irregular periods is stress, whether physical or emotional. This may lead to a disruption in the hormonal interplay that results into the menstrual period or cycle. So when a woman is stressed, there is a likelihood of having an irregular period. The second factor under the pathological causes of irregular periods is weight. A change in weight. Talking about being either overweight or underweight. This also is a cause of an abnormality or abnormalities in the hormonal interplay. that results to irregular periods. And there can be primarily hormonal changes, intrinsic factors, external factors that actually cause an abnormality in the levels of the hormones, talking about estrogen, progesterone levels, which are hormones responsible for the changes that take place during the menstrual cycle. So when a woman has abnormal levels of these hormones during your cycle, then you may experience irregular periods. Some other causes of irregular periods include birth control pills. Women will take pills for family planning, steroid containing medications. This can be a cause of irregular periods. Smoking has also been implicated in irregular periods. Now let's talk about medical causes under the pathological causes of irregular periods. One very common cause of irregular periods is polycystic ovarian syndrome. Polycystic ovarian syndrome, that's PCOS. Uterine fibroids are also a cause of irregular periods. Abnormality in the functioning of the thyroid gland, anemia, some organ dysfunction like pituitary disorders can also be a cause of irregular periods. Endometriosis is also implicated in irregular periods. Okay, let's talk about the diagnosis. How is the diagnosis of irregular periods made? It is very simple. It begins with a history. Of course, as a woman, you observe these changes in your body from the normal pattern. So in terms of the frequency, normally woman should see her menses, have a menstrual experience every month. So if it is no longer every month, then you may need to see a doctor for proper evaluation. Then in terms of the duration, there are no fixed days in terms of the duration. However, if you watch the video on normal menstrual cycle, you will notice that changes should normally take place. Cycle length should be between 21 to 35 days. So within that range, and then the woman can see 2 to 7 days. It will also be the changes in terms of the amount of bleeding, as in terms of volume, it may now be lighter or heavier. So when you see a doctor, you make your complaints. Doctor will ask many questions around this and around your reproductive cycle, reproductive health, other medical related conditions that you may have, and then if you have had a surgery before, and so many other things including the medications that you have been taking. Then a proper examination will be done, general examination, specific examinations, gynecological examinations will be done to find out if there are causes that are manifesting in your body physically because of the irregular menses. Then some investigations will also be carried out. Investigations, blood investigations, physiological investigations may also be carried out to confirm this diagnosis. For example, the levels of hormones, hormonal profile will be done, importantly, to check for levels of hormones, important for drug management. So how do you treat irregular periods? How do you treat irregular periods? Simple. Simply, the approach depends on the cause of the irregular periods. So generally, for a person whose reason for having irregular periods is related to stress, whether physical, emotional, that means dealing with stress, physical methods, relaxation, and then emotional stress requiring therapy, psychotherapy, cognitive behavioral therapy, seeing a counselor. These are ways to manage stress-related irregular periods. Another way to manage irregular periods has to do with addressing the issue of weight changes. As mentioned earlier, remember, being underweight or overweight, some people may even be obese, can lead to irregular periods. So weight control, very important. You may need to see lifestyle medicine doctor to help in the kind of approach or the ways that you can do a proper weight control to help in dealing with your irregular periods. Interestingly, a number of women have had positive results. In fact, even for those who were having issues with infertility related to being underweight or being overweight, and then when they were able to achieve good weight control, regular menses resulted, and then they were able to conceive. So do not take this lightly. See your doctor if you need to. Regular exercises also help in regulating the period. Now, for a woman, there are certain exercises that can be done: cycling, swimming, indoor exercises, and then this should be under the guidance of your doctor. If you have some medical condition, then you may need to see your doctor to determine the type of exercises that you can get involved in. Brisk walking 30 minutes for 5 days in a week is good, recommended for healthy living, helps in circulation, and then the feeling of helps in circulation, and then the feeling of wellness, which will also be helpful for management of irregular periods. Then it's important to note that some people, you may need to stop some medications that may have been identified as being cause of regular periods. For example, if you are on some steroids, your doctor may need to review your medications, and if you are on some oral contraceptive that you may need to stop, then your doctor may recommend this for you. Some people will benefit from hormone therapy, medications to help in regulating their menstrual period. Those with some surgically related conditions like endometriosis, uterine fibroid, some tumors, then they may benefit from surgical interventions that may help to regulate the menstrual cycle. In this video, we have looked at what irregular periods are, what the causes of irregular periods are, the symptoms of irregular periods, the diagnosis of irregular periods, and then the management of irregular periods. If you have any questions, if you have any comments, if you need clarifications, then drop a comment in the chat box, which I will respond to. And then if you need further clarification, you may need to see your doctor for proper consultation.